Welcome to Ask Your Doctor. I'm your host Shivani Raj. For today's show, we have Dr. Damodhar Garu, who is an MD in internal medicine. On today's topic, we will be talking about the sudden cardiac deaths that are happening around the globe. Also, do note that on our shows, we do talk about different health related topics. We do cover everything, absolutely everything about internal medicine and health care. So, without any further delay, let us welcome Damodhar Garu onto our show. Damodhar Garu, welcome, Andy. How are you?
Thank you, Shivani Garu. I'm doing very good, Andy, and I hope you all doing good too. So I'm glad to be back on the show, and it's a very, very important topic you chose today, which is
Yes,
really creating a lot of anxiety in the younger generation and all age groups.
exactly.
Because a lot of times people are dying in the sleep, on the treadmill, and on playgrounds like young kids. Awareness programs. We need to educate people this time. So before going to questions, I'll just give a brief introduction and etiology of the topic. So basically, sudden cardiac death, and it is defined basically as two things. One is sudden cardiac arrest and sudden cardiac death. సో ఇలా రెండు టాపిక్స్ లా ఒకటే, కాకపోతే ఏంటంటే సడన్ కార్డియాక్ అరెస్ట్ వీ విల్ సేవ్ ఇన్ ద పేషెంట్ సర్వైవ్స్ అండి, అండ్ సడన్ కార్డియాక్ డెత్ అంటే లైక్ పేషెంట్ యూనో కైండ్ ఆఫ్ ఎక్స్పైర్స్ అండి. సో ఇక్కడ డెఫినేషన్ ఏంటంటే ఈ సడన్ కార్డియాక్ డెత్ అంటే సడన్ గా యూ లూజ్ ద కార్డియాక్ pumping capacity, so it stops pumping. And then what happens is ischemia happens, and hypoxia happens. Oxygen supply lack అయిపోయి suddenly patient collapse అండి. Collapse అయిపోయి unresponsive అయిపోయి, so immediate గా they will go into death. Etiologyకి వస్తే most of the time అండి 60 to 70% of the time ఆల్రెడీ హార్ట్ డిసీజ్ ఉన్న వాళ్ళకే వస్తుందండి.
Okay.
అంటే సంబడి మనం డిస్కస్ చేసినట్టు ఇంతకుముందు సంబడి హూ హ్యాస్ హార్ట్ అటాక్, ఆర్ సంబడి లాస్ట్ వీక్ వి డిస్కస్డ్ కంజెస్టివ్ హార్ట్ ఫెయిల్యూర్ విత్ లో పంపింగ్ కెపాసిటీ, దట్ మీన్స్ లో ఎజెక్షన్ ఫ్రాక్షన్. సో వాళ్ళకి ఎక్కువ రిస్క్ 60 to 70% ఆఫ్ ద టైం వాళ్ళు. తర్వాత మన ఫోకస్ ఏంటంటే నాన్ కార్డియాక్ కాజెస్ అని రివర్సిబుల్ కాజెస్ మీద మనం ఎక్కువ ఫోకస్ పెడదాం అండి, ఎందుకంటే అక్కడ మనం సేవ్ చేసినాం ఇంకో పేషెంట్ ని, సో దే విల్ లివ్ ఎ నార్మల్ లైఫ్. రివర్సిబుల్ నాన్ కార్డియాక్ కాజెస్ ఒక 10% వస్తాయండి, 10 to 15%. దాంట్లో మేజర్ థింగ్ మనం ఫ్యూచర్ లో లంగ్ ఇటియాలజీ పోయినప్పుడు డిస్కస్ చేద్దాము, అక్యూట్ పల్మోనరీ ఎంబోలిజం అంటారండి. సో తర్వాత చాలా మంది ఇప్పుడు యంగ్ జనరేషన్స్ డ్రగ్స్ తీసుకుంటారు కదండి, డ్రగ్ ఓవర్ డోస్ కెన్ ఆల్సో లీడ్ టు సడన్ కార్డియాక్ డెత్ అండి. తర్వాత ఈ బాడీ బిల్డర్స్ బాగా ఎక్సర్సైజ్ ఫిట్నెస్ వాళ్ళు ఏమవుతుందంటే దే టేక్ సప్లిమెంట్స్ అండ్ ఆల్, సో దే మే హ్యావ్ సమ్ హైపర్ట్రోఫిక్ కార్డియోమయోపతి అంటారండి. లైక్ ఇఫ్ దే హ్యావ్ ఎ జెనెటిక్ ఎలిమెంట్, ఇట్స్ కాల్డ్ హోకమ్. మనం లాస్ట్ టైం డిస్కస్ చేసినప్పుడు వన్ ఆఫ్ ద రీజన్ ఫర్ హార్ట్ ఫెయిల్యూర్ అన్నాం కదా, హార్ట్ ఫెయిల్యూర్ కి వన్ ఆఫ్ ద రీజన్ ఈజ్ హైపర్ట్రోఫీ, అంటే మజిల్ థిక్ అయిపోతుంది. హార్ట్ మజిల్ థిక్ అయిపోయినప్పుడు మనం హైపర్ట్రోఫీ అంటాం. సో వాళ్ళ లోపల కూడా రావచ్చు. సో అప్పుడు ఏమవుతుందంటే ఈ పొటాషియం అనేది హై పొటాషియం ఉన్నది అనుకోండి, డయాలసిస్ పేషెంట్ లో హై పొటాషియం డయాలసిస్ ప్రాపర్ చేయనప్పుడు కూడా వాళ్ళు సడన్ గా చచ్చిపోవచ్చు. సో ఆ పొటాషియం కరెక్ట్ చేస్తే వాళ్ళు బతికిపోతారు. అట్లనే ఇప్పుడు డ్రౌనింగ్ ఉన్నారు కదండి, మనం డ్రౌనింగ్ సూసైడ్ చేసుకొని కదా, అది కూడా సడన్ కార్డియాక్ డెత్. ఇమీడియట్ గా వాళ్ళని బయట తీసి సిపిఆర్ చేస్తే బతికిపోతారు వాళ్ళు. సో అట్లా ఇఫ్ యు లుక్ ఇంటూ రివర్సిబుల్ కాజెస్, ట్రామా అండి, సంబడి హ్యాస్ యాక్సిడెంట్, they can go into sudden cardiac death. So these are some of the reversible causes. If I'm not missing, there are two more important lung causes అండి. One is pneumothorax. న్యూమోథొరాక్స్ అంటే ఏమైందంటే ఇప్పుడు ఎయిర్ లీక్ అవుతుంది అన్నట్టు, లీక్ అయ్యి లంగ్ కొలాప్స్ అయిపోతుంది. సో మన లంగ్ ఒక లేయర్ ఆల్వేస్ ఉంటుంది అన్నట్టు. ఆ లేయర్ కి లంగ్ కి మధ్యలో ప్లూరల్ స్పేస్ అంటారు. ఎప్పుడైతే ట్రామా కానీ లేకపోతే లోపలికి వెళ్ళి ఇంటర్నల్ గా మన బ్లడ్ రప్చర్ అయినా కానీ ఎయిర్ లీక్ అయినప్పుడు ఏమైందంటే లంగ్ సడన్ గా కంప్లీట్ గా కొలాప్స్ అయిపోతుంది. సో దాన్ని న్యూమోథొరాక్స్ అంటారు. మనం ఫ్యూచర్ లో అది కూడా డిస్కస్ చేస్తాము. అది వన్ ఆఫ్ ద ఎమర్జెన్సీ. సో దాని వలన కూడా సడన్ గా దే కెన్ గో ఇన్ టు సడన్ కార్డియాక్ డెత్. సో ద నెక్స్ట్ మోస్ట్ ఇంపార్టెంట్ థింగ్ ఆల్సో ఇస్ అ సిమిలర్ కైండ్ పెరికార్డియల్ ట్యాంపనెడ్ అంటారు. ట్యాంపనెడ్ అంటే మనం ఇప్పుడు హార్ట్ అనాటమీ డిస్క్రైబ్ చేసినప్పుడు మనం కొన్ని లేయర్స్ కవర్ అవుతాయి అని చెప్పినాం కదా, పెరికార్డియల్ ఎఫ్యూజన్ అన్నప్పుడు. ఇప్పుడైతే సడన్ గా ఇప్పుడు మజిల్ రప్చర్ అయింది అనుకోండి, హార్ట్ మజిల్. సో ఏమవుతుంది అంటే బ్లడ్ సడన్ గా పోయి అందులో స్టక్ అయిపోయి పెరికార్డియల్ ట్యాంపనెడ్ అంటారు. ఈవెన్ ఫ్లూయిడ్ అక్యుములేట్ అయినా కానీ పెరికార్డియల్ ట్యాంపనెడ్ అంటారు. అప్పుడు ఏమవుతుంది అంటే అప్పుడు కూడా సడన్ కార్డియాక్ డెత్. సో ఇవి సింపుల్ ప్రొసీజర్స్ తోటి వాళ్ళని మనం బతికించవచ్చు. ఇప్పుడు న్యూమోథొరాక్స్ సడన్ గా ఒక నీడిల్ పెట్టినాం అనుకోండి, ఇక్కడ ఎయిర్ బయటకు వచ్చేసిందంటే బతికిపోతారు. సో డయాగ్నోసిస్ ఇస్ వెరీ ఇంపార్టెంట్ అన్నట్టు ఇక్కడ. సో మనం ఎప్పుడు కానీ ఇప్పుడు నెక్స్ట్ మనం డిస్కషన్ లో విల్ డిస్కస్ హౌ టు సేవ్ పీపుల్ హూ కెన్ బి సేవ్డ్. సేమ్ పెరికార్డియల్ ఎఫ్యూజన్ కూడా అంతే, ట్యాంపోనేట్ కూడా సడన్ గా యూ పుట్ ఎ నీడిల్ ఇన్ టు ద హార్ట్, where that space the fluid is accumulated and take it off, then they will start breathing normally. So these are some of the reversible causes, Andy. So these are some of the statistics.
So, doctor, I think up until like 15 years ago, when somebody were talking about cardiac health or cardiac death, it was always at a point. I think majorly, I might not say always, but majorly we would hear it was for someone who was above the age of 65. So, it was characterized like that. It was categorized like that. It was like anything. Okay, if somebody's having a heart problem, it is someone who is older than 65, someone, probably who's having a bad, health issues or stuff like that. But nowadays, you're saying very unfortunate, even so many actors who are in limelight, who definitely have a great, of course, health, everything. Like they have they're good at their fitness, they have their necessary supplements. They also do. It's not that they don't have any, what do you say, exposure to good mental or health care. So there is stuff like that. But why do you think it is happening to people lesser than 65, especially, and why is it unfortunately happening to people around, in their 20s also, like, which is very unfortunate?
Very, very important question, Andy. Like, like young people developing sudden cardiac death is very unfortunate. But to answer to your question, even now, the sudden cardiac death is, like I said, 60 to 70% happens in the age group more than 55 years, who has underlying already either a heart attack or congestive heart failure, stuff like that. But in young people happening is very rare. But still, it's an important thing because, we won't, even if it is a small percentage, there are so many advanced technology to identify them. So basically, the young people, especially, a lot of times, most important thing is family history and Shivani Garu, like I always mention. If somebody in the family died young age due to cardiac disease, I think those people have to get some screening on it. Especially who are like very, competitive sports level. Competitive sports level, it's very important to get some screening test, especially, a lot of times these congenital anomalies and these, discussed hypertrophic obstructive cardiomyopathy, it runs in families and so when they have that, they don't know, but when they are vigorously exercising, then they can get into this sudden cardiac death. Like I said, the heart is very thick, and when you are not meeting the requirements of the body, especially when you are exercising, you need more oxygenation, more blood supply, and the heart has to beat really fast. That's the mechanism we have. So these young people, if they can screen for it, like, let's say get a basic EKG and echocardiogram, and I mean, like, first of all, they need to see the doctor, especially whoever has family history. They can go in detail with the history and physical examination. You can find some heart sounds and murmurs, where they can, critically also identify and send for the confirmatory test. So history and physical examination is very important for this young generation. And like the other things I said, the reversible causes, like, these drugs and, these stuff, like, if you go, like, get the screening stuff, and education is very important, most of the time. And also young people, sometimes they may end up on dialysis at a young age because of the diabetes and high blood pressure. So those people, actually, I was surprised to see. I mean, like, even let's say the EKG, just the EKG, and it can identify the left ventricular hypertrophy. Hypertrophy అంటే ఏంటి, like thickening of the muscle. So అప్పుడు ఏమవుతుందంటే you can auscultate and see, and then you can get echocardiogram, because one of the reasons, one of the predictability, if the heart muscle is thickened, the people dying with sudden cardiac death is high. So like I said, coronary artery disease already with people who have heart attacks, very high risk for dying suddenly in the sleep or in the exercise or wherever. But next category comes is congestive heart failure, which is also one of the complication of coronary artery disease. Heart attack వచ్చిన వాళ్ళకు ఎక్కువ మజిల్ వీక్ అయిపోతుంది కదా. I mean, like scarring వస్తుంది, ఫైబ్రోసిస్ అవుతుంది, వీక్ అయిపోతుంది. నెక్స్ట్ కేటగిరీలో హై బ్లడ్ ప్రెషర్ అండి. హై బ్లడ్ ప్రెషర్ బాగుండి కంట్రోల్ చేయలేదనుకో, అదేమైందంటే ఇట్ కెన్ లీడ్ టు ద థికనింగ్ ఆఫ్ ద హార్ట్ మజిల్, which can cause also, sudden cardiac death. So young people, I think it is very important to screen them, especially if they are into a lot of vigorous activities, competitive sports, and if they have a family history. So that's the most important thing.
Yes. Doctor, I have a slight doubt because
Mhm.
when I know, but I'm just like, whenever you're saying something, I kind of try to relate around my friends or if I've seen
Sure,
any
sure,
family members. So
sure.
the one thing that I've noticed is, I'm not saying all men are like that, but mostly men around me, or men you know, in India especially, alcoholism is very common here. You see, I've seen men who will drink every day. Like, it's just like, once they come from their work, they have to have their amount of alcohol, which is really unfortunate. Some are very, see, I'm not saying that, nobody drinks and you this and that. Some do have it as a pleasure, some have it as their routine, which is unfortunate. So I've also
Well,
seen that a lot of these people, once they're hit their 55 or their 50s also, they have something like their diabetes is worsened. They're not able to control their diabetes, or their heart issues have come out of nowhere, being from a healthy family and stuff. So even these, of course, like, these are something that has happened to you because of their unhealthy lifestyle. So even their kids or their generation, must they be under control? Like, must they worry about it, or else is it just like, what's the whole deal with it?
when I say drugs, alcohol is also kind of, you have to consider the drugs.
Yeah.
Smoking also. Alcohol can lead to cardiomyopathy also. This is called dilated cardiomyopathy. So a lot of times, sudden cardiac death can happen not only in the coronary artery disease patients related to ischemic cardiomyopathy, but also it can happen in dilated cardiomyopathy, where these alcoholic abusers can develop also congestive heart failure because the heart gets dilated. And also the next most common reason for people who suddenly dying is arrhythmia అంటామండి. Arrhythmia ante, even though their heart circulation is good, lot of times alcoholics వాళ్ళ blood vessel circulation బాగానే ఉంటుంది. అదేమవుతుంది అంటే, ఇప్పుడు మన రిథమ్ అంటే ఎలక్ట్రిసిటీ లాగా మన కరెంట్, ఇప్పుడు హార్ట్ కంటిన్యూస్ కొట్టుకోవాలంటే యూ నీడ్ టు హ్యావ్ దట్ దట్ whatever conduction, there is a SA node, AB node. We'll come into that in next topic. What happens is, in these arrhythmogenic sudden cardiac deaths, the most important thing is ventricular fibrillation. You know, we talked before, ventricular tachycardia happens, and once ventricular fibrillation happens, then it's a sudden cardiac death. సో ఇవే కాకుండా బ్రాడీ అరిథీమియా అంటారు. బ్రాడీ అరిథీమియా అంటే హార్ట్ రేట్ స్లో అయిపోతుంది.
Okay.
స్లో అయిపోయి ఇట్ విల్ స్టాప్ బీటింగ్. ఇట్స్ కాల్డ్ ఏసిస్టలీ అంటారు.
Okay.
ఏసిస్టలీ అంటే దర్ ఇస్ నో లైక్ వీఫిబ్ అంటే ఇట్స్ గోనా బీట్ వెరీ వెరీ ఫాస్ట్. బట్ ఏసిస్టలీ అంటే ఇట్ గో స్లో ఇట్ విల్ స్టాప్. So this can be also one of the reasons why alcoholics will die when there is dilated cardiomyopathy. They may go into pulseless electrical alterance, or they may go into one of the most common complication with alcohol, and they may go into irregular heart rhythm, which is a major subject actually. One day we'll discuss that also. It's called atrial fibrillation, they call. So there is dilated cardiomyopathy, there is ischemic cardiomyopathy, there is non-ischemic, and there is hypertrophic cardiomyopathy. So majority of the causes, like autopsy, I was studying articulately, autopsy cheste, whoever died suddenly, they want to see why they died. 70%, more than 70% of the time, the patient already had cardiac, heart attacks and congestive heart failure. And when you have obviously heart attack, wherever that perfusion is gone, scarring aitandi, so then it gets weaker. So major autopsy finding is coronary artery disease. Next comes all these causes I described. When my patients, they ask me, doc, I like to drink and I drink every day, I tell them, okay, how much you drink? They'll say, usually they'll tell less. A lot of times, if they drink drink 4 drinks, they'll say, oh, I drink 2 drinks.
Yeah.
So basically, for women, 1 drink a day. For men, 2 drinks. I mean, like once you cross that limit, then you kind of get into a pattern of addiction. And that can lead to all these problems like atrial fibrillation, high blood pressure, diabetes, coronary artery disease, even cancers. Alcohol ఎక్కువ తాగితే క్యాన్సర్ రిస్క్ కూడా ఉంటుంది. సో దీస్ ఆర్ ఆల్ థింగ్స్ హ్యాపెన్. సో ఎవ్రీథింగ్ ఇన్ మోడరేషన్. బట్ మై సజెషన్ ఇస్, ఇఫ్ శివాని గారు, ఇఫ్ యు ఆర్ నాట్ drinking, I would say don't drink. Like, if somebody is not used to drinking, better stay off. Don't get tempted that, oh, if I drink, I'll live longer.
Yeah.
Because all my old patients, I take extra time to see what their habits are. Whoever lived 90 to 100 years, a lot of people actually never smoked, never drank also.
Great. Yeah.
So that much I advise viewers, like if they are not drinking, don't drink. If you are drinking, just in moderation, like, and like they say for women, 7 drinks a week. So maybe you can drink 2 drinks every, other day, or, like that. And for men, 14 drinks a week. So that means, like, sometimes if they want to drink 3 drinks in a party, so like, 2-3 times a week. Or if you are very, kind of, disciplined guy, I mean, like dinner times, European countries, Italian countries, they drink wine with dinner every day. They live longer, but they have the control. I mean, like it's there in their, culture.
Their food habits are also very different than ours. I feel like they have
exactly.
a lot of talents. And the one thing, like my dad always used to say, he lived in France for many years. He would say this one thing, he'd say, you're drinking, it's fine, but don't eat this chakna that Indians have. He'd say, never team up alcohol with chicken, never team up alcohol with peanuts, where peanuts in India, or especially Telangana, is very famous. I remember that have these chips. He would say, rather eat a salad or something. I really want to know if whatever your answer is, I'm going to showcase to all my friends, because they always tease me. They'll be like, why are you giving this lecture and stuff like that?
They consume more salty foods.
Yeah.
Right. So that will also be a problem, because it will cause high blood pressure and, fluid retention and all that stuff. Plus, when you're drinking, you don't know how much you are, munching, snacking, Wine is just like grape juice, like you're just so there's a lot of calories.
Of course.
So eventually, what happens is the weight gain happens, and then all the problems will start. There is always a risk. Nothing comes without risk, but you have to learn your way around. If you like it, well, if you don't do it, then don't do it. If you don't want to. A lot of companies advertise, oh, if you drink, your cholesterol will get low, you will be longer. You see on the WhatsApp a lot of messages. It all depends. Let's say, you like to travel, you travel, you want to relax, drink, but, within moderation. Everything in moderation. I want to focus mainly on the preventable causes and save people who go into this sudden cardiac death. Andy. The most important thing, Andy, it starts with palpitations, Andy. People may start feeling their, skipping heartbeats, and then sometimes it may go like fast, like 5-6 beats, and then go back to regular. So it's called non-sustained ventricular tachycardia. So when you are in the hospital, we can catch it on the monitor. And when the non-sustained ventricular tachycardia is more than like, few seconds, then we get the cardiologist to intervene and check for, all the echo and, EP studies under not, they can do electrophysiology conduction studies. So if you are having those symptoms, especially young people with palpitations, I think it's better to address that. And ventricular tachycardia can lead to ventricular fibrillation, we call VFib.
Yeah.
So that's the end. When VFib happens, you got to do CPR and resuscitate and shock. Shock is gold standard. Like unless you shock them, they're gonna die. But how much time you have? How much time you have? That's an important question. Somebody goes into ventricular fibrillation. If you don't resuscitate them properly and shock them properly, they'll die in minutes. So if somebody is already gone to asystole, what I said, asystole and pulseless electrical activant, they are gone. Okay, it's very unlikely to bring them back, but sometimes it may be luck. God may, kind of thing. But ventricular fibrillation, there is a chance if you shock them, right? So the most important thing, and Shivani garu, mana India lo EMS. EMS at emergency medical services, very important. If they are less than 8 minutes, the data shows it's helpful. But in India, it's very difficult. So I think the government has come up with all these good things, CPR training, which is very, very useful to save these kind of people. So CPR, I think it has to be initiated in all the schools and high schools. A lot of times, grandparents, parents, I think they collapse at home. I think the chances of survival is if the kids know what to do, how to do the CPR. And the next thing, Andy, we discussed a little bit, keeping these
Oxygen.
defibrillators in the parks, right?
Yeah.
If somebody is jogging and suddenly collapse, or defibrillator in the gyms, So there is actually AED and very automatic external defibrillators. They will tell you also this rhythm needs shocking. So these are very important to teach the kids, like high school children, not very young, high school children, and also the general public. Of course, the police already getting all the CPR courses, which is a good thing. I think the more knowledge people have about CPR and the shocking and the AEDs, the chances of survival is high, because if you have to depend on like EMS, ambulance services, it's very difficult because it's only minutes they will die if they go into ventricular fibrillation. Especially the two kinds of congestive heart failure మనం డిస్కస్ చేసినాం కదా. ఒకటేమో ఇస్కెమిక్ కార్డియోమయోపతి అంటే హార్ట్ అటాక్స్ తోటి వచ్చిన వాళ్ళకి, నాన్ ఇస్కెమిక్ అంటే ఇప్పుడు ఆల్కహాలిక్స్, డైలేటెడ్ కార్డియోమయోపతి వీళ్ళు వచ్చినాయి కదా. If somebody's ejection fraction drops to less than 35%, they qualify for AICD. Especially మీరు అన్నారు చూడండి, ఆ type of patient, dilated cardiomyopathy, you have to immediately put them AICD. Whereas these heart attack people, you can try some medication before. Beta blockers are there, ACE inhibitors are there. And then the most important useful drug is amiodarone and the beta patient survive. Okay,
Mhm.
so obviously those are the important things. So if they go and get those AICD placed, it will automatically shock when they go into that rhythm. Nobody has to shock them. It will shock internally.
Internally. Understood.
Internally. That
I
is called automated implantable cardiac defibrillator. As soon as the patient starts having VFib, it will give a shock.
understood. So
Internally, you have that. So you have that. So there is data which is actually very useful to save their lives.
I think, Doctor, we can discuss more in the next episode. I think we will again put a dedicated episode on this topic because it is quite an interesting topic because we still have to
Sure.
cover the anxiety and panic and how that can also, get
Oh,
into.
yeah, it's extensive topic. So it's extensive topic. The another thing you can include in this show and is like post CPR. Post CPR, immediately has to get into coronary unit, and they need to
Yeah,
get all the set of standard protocols, and also they have to cool the body. Cool the
understood.
body, keep the temperature in like 32 to 30 5 degrees, so that the brain function don't get damaged.
I think, Doctor, we can definitely have another episode too. Thank you again, Damodhar Garu, for tuning in. It's always lovely to have you. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.